At World Remit, we understand what the journey is about, how it can sometimes take a little distance to bring us a little closer together. With ways to save more when you send more, World Remit is here for you, so you can be there for them.
Thank you, thank you. Thank you, everybody. So I'm going to tag you guys. And when you're not talking, please, if you can unmute yourself, so because sometimes there's noise at the background. Okay. Okay, thank you. Thank you very much for joining me again today. I have the same guest today. We are actually celebrating Mental Health Week. Is this Mental Health Week or just for the children? So we are actually discussing about safety as well, safety nets and everything, because this week is all about mental issue. And we need to also, to always give mental issue or mental illness or mental health week, we always have to give it time, because I realize that a lot of times is because a lot of time we marginal people with mental issues are always marginalized, and because of that we tend to shy away, or we tend not to talk about it, or we tend to not even give it time or attention, and that's not good. So we should. So today I'm here with me. I have Veronica, I have Esther, and I also have Cindy. So if you can just introduce yourselves, please. I'll start with Veronica. Thank you, Veronica.
Thank you, Lydia. Hello, everyone. And for those people who are watching us on Facebook, welcome to this session, which is very important. We're talking about mental health. My name is Veronica Kararwa. I'm a mental health practitioner with 14 years of experience working in various roles as a mental health practitioner. So I've worked with addictions, I've worked with complex needs, I've worked with criminal justice. I've also worked as a behavior therapist, which we call DBT. So, and at the moment, I'm working with child and adolescent young people. So I just got quite a variety of experience in working with people suffering from mental health in different, in different aspects. Thank you.
Thank you so much, Veronica. Okay, so I'll go to Esther, please.
Good evening, everybody. Thank you for joining us this evening. My name is Esther. I'm a writer and a mental health professional. I write on our website, thingsihear.co.uk, where I talk about mental health issues through storytelling, just to debunk some of the myths surrounding mental health, attitudes, and behaviors. So thank you so much for joining us this evening.
Thank you very much, Esther. Okay, so I'll go to Cindy Lawrence. Cindy, please.
Hi, I'm Cindy Lawrence, bereaved by suicide. That's why I'm here. Nice to meet everybody again.
Thank you. Thank you very much. Thank you very much, Cindy. Okay, so we are back with mental illness or mental disorder talk. Last time we actually spoke about the same issues, but we thought we come back because the topic was a lot of people still wanted us to come and talk about these issues. And also being that this week is a mental health week, we thought let's come back again and touch on to that. Because talking about mental health or mental disorder is something that it's not a one-day thing. It's not even a one-week thing, because it's vast, it's big. So last time we only touched on mental disorder, and we only touched on some of the mental disorder issues. We didn't even reach half of it. So last week as well, we spoke about some of the mental illness disorders, which was depression, bipolar, eating disorders, personality disorders, post-traumatic stress, psychotic disorders. And we also spoke about the definition of mental illness, and we realize that mental illness is actually divided into two. There's disorders and there's illness, but most of the time we just put them in one. Most of the time we just see somebody, and like Veronica rightfully said, we always call them mad people. And that's because that's how we associate them, especially in an African community, is those people who run on the road without clothes. And we say, oh, that person is mad, and we just shy away from these things. But me doing my research this week, I just realized that they say that 1 in 4 people, 1 in 4, that's a big number, that 1 in 4 people actually in the span of their lifetime, they do suffer either mental health or mental disorders. And that's a very, very big number to talk about. We also spoke about who is more prone to get it, either ethnicity or age-wise, or we spoke about gender, we spoke about ethnicity, and we spoke about age, who is more prone to get it. We also spoke about the symptoms and how can you tell. We spoke about if they can be a danger to themselves, and that's when even Cindy came in, because Cindy's son, Sean, actually committed suicide. So yes, we discussed the fact that they can be a danger to themselves, and they can also be a danger to the society or the community unless they seek for help. So today, and we also concluded last week that what we need to do more is listen to understand and not to respond. And we also spoke about don't isolate yourself, talk to someone, especially seek for professional help. And just to know that you are not alone. There's always people out here to help. So with today's discussion, again, I'll start with Veronica. And Veronica, there's this say that says the problem with having problems is not that someone, it's that someone always has it worst. And I said, I'll start with you to explain that more, elaborate that more to us. Would you agree with that statement, Veronica?
Yes, I do. Yes, I do. Yeah, I think what it says is that whenever you have a problem, sometimes you have a tendency of thinking that it is so bad. And then we have this kind of that tunnel vision of this is me, this is, I'm having it so bad, and nobody ever had it so bad. But what that's saying is that even if you have it bad, there is somebody who is having it worse than you are. So it's always good to think not to have that kind of a victim mentality. Like sometimes we can have this idea that it's all happening to me. This is it. Nobody else have ever experienced anything like this. So, but it's always to have a think that although it is bad, somebody somewhere out there is probably having things worse than I have. And it might not also be the same problem. It could also be with other problems and other problems. So the idea is just not to have that thought, but to really be able, it's a very good coping skill, in fact, to think like that, because sometimes when you are in that tunnel of thinking that way, then you can feel crushed and you can feel so depressed and you can feel like you're never gonna be able, you might think the whole world is against you or everything is just turning against you. So that is, I think that's what statement is alluding to.
Okay, so it's more of a coping mechanism. No,
Yeah.
thank
not
you
to
very
think
much.
that, not to think like that, but to think that if somebody else somewhere is having it worse than I am. So and having like the way you say it could be worse, you know. Yeah.
Okay. Okay, thank you, Veronica. And I also have, today I like the fact that I came with some proverbs, so so some people can relate their lives with it. So I also want to ask Esther, or maybe I'll ask Cindy this one, because I know Cindy has been open with what she's going through, and she told us as well last time what she's going through, so it's good. So I'll ask Cindy, first of all, who'll explain to us what you're going through, because some people who are here today, are here now, probably were not here last time, so they don't really know what is Cindy going through. So just you just tell us just a little few words, what has happened in your life. And then I'd like you to answer this as well, or to expand to this. It's more exhausting living a lie and pretending it does not exist. So it's more exhausting living a lie and pretending it does not exist. Would you agree with that statement, Cindy?
It's very difficult to actually explain what one goes through. There's just no words. You just learn to live life every day. It's just surviving the day. And yeah, I do agree with some of the things that's been said. Yeah.
So just in few words, just tell us what you've been through, what you've gone through. And I like the fact that you did not pretend, but you actually came out and shared with us what you're going through. And you actually said, yes, guys, I'm struggling. I'm here. Depression, help me. So how did we get to that?
And losing any loved one is very, very difficult thing, but losing your child is unimaginable. For somebody like me, my experience is very different because I'm more traumatized. I'm kind of depressed and traumatized at the same time because of watching the CCTV of my own child ending his life. That traumatized me. And because of the COVID-19, I had to deal with this dead body. So it's not just my child just committed suicide. I had to deal with all that, like wash him and do the funeral. So it's so traumatizing. And the experience of it, it's just living with it. Every day is different. You just wake up and you're like, okay, it's another day. So yeah, it's a very difficult thing. It is. I just can't even explain what I'm going through. I would like anybody who's watching this to know it's a very difficult thing, and anybody who's thinking of ending it, please think again what you're going to put your family through and seek professional help, or just talk to anybody. Yeah.
I know sometimes we sit back and some people will say that, oh, somebody who's taking their own life, they're selfish, or how can they do that? But I'm just going to ask Esther this. Do you think that somebody will just take their life, or is there something always attached to it, like mental health or mental disorders?
Yes. First of all, I just like to say again to Cindy, it's very brave for her to come out and talk about this, because as she clearly says, is apart from the fact that the whole thing happened, is also very traumatic. And you can imagine, even you, if you see a stranger, is to be traumatic for you. So I can't even imagine how you feel for, seeing your own child, the CCTV, that can be so dramatic. I mean, it's going to cause some trauma in your life. So sorry, Lydia, what was the question?
Yeah, I said, if with what Cindy went through, some people will say that, or people commit suicide, they're selfish, or why did they have to do that? But they forget that someone will not just go and do that. There's always either, I don't know, because this is not my area of expertise, but don't you think that either if it's mental health issues attached to it, or mental disorder, or do someone just wake up one day and say, okay, I'm going to kill myself today?
What research shows is that usually there's something underlying, there's something bubbling beneath the surface. So somebody can be going through something and they don't think anyone can help them, or talking to somebody is going to solve anything. So they keep to themselves. They may appear to be okay, to your face, and even when you're talking to them, they will look calm and they will look happy, but beneath they are fighting something nobody can explain. They probably don't even understand it themselves, and since they don't understand it, they don't even know where to start to look for help. And then it just gets too much that it reaches a point that you can't even see the point of anything. You can't reason beyond just ending it all. You just feel probably the world is better off without me, or probably this problem I have is just going to bring more problems to my family. So it's better if I'm not here at all. So their reasoning and their logic is not as you'd call a normal reasoning. They are reasoning from a depth of some turmoil that no one else can understand apart from them. And unless somebody else, that's why most people, when they they attempt suicide and fail, and they're taken to a hospital, and then there is some sort of intervention by some professionals, then they can be helped. But if they're successful, then, you know, there's nothing much anyone can do. But usually it's not because people are selfish, it's because the point they cannot even reason with anyone. They cannot reason with themselves, and they don't see any outcomes as positive.
Mm, mm.
So I don't think you'll be wrong to say it's a selfish act.
So Veronica, yeah, like Esther rightfully said that yes, they're going through this and they're going through. So imagine now, here comes that we don't even know.
Yeah.
So how do we break that down? How do we get through somebody? What? Because I know you work as well with suicide, Veronica, and that's why I want to ask you this. So how do we deal with this? I'm a mother.
No.
I don't even know my child is going through this. The next thing I hear, just exactly like Cindy didn't know anything. So how can we help a parent in this situation to be avoided?
So to be honest with you, as Esther has said, we don't know what is happening or what people are thinking, what is bubbling underneath. Now, and that is why we encourage people to talk and to express their emotions and to say what they're feeling and what they're thinking. Because if they don't, then sometimes they catch us, they catch everybody by surprise. The other thing we can only do is to be observant. But then sometimes, and especially for children, it's very difficult because like when things are normal and when you're busy, when you're doing things and things can go under without you noticing.
Yeah.
So that is why it's always good to get to, because the only good thing is to get to know your loved ones, get them to talk and to express, know when things are changing, like when their moods are changing, when they are withdrawing, when something is amiss or is not kind of gelling together. Don't be afraid to ask. Don't be afraid to find out what is happening.
Yes.
Even when you have even an inkling of suspicion, please be able to have the guts to ask what could be happening. However, we always say sometimes there are those we might not be able to save because it is as it is that they have made that decision and maybe nobody will be able to, and they stay with it, they make a decision. Remember, we are all individuals and people do make that decision and they just don't share it with anyone. They don't want to share it with anyone. It's their right anyway. And then they just make that decision. They're going to end their lives. What we can do is just to do the best we can to make sure that we have done the best we can so that we don't have also to blame ourselves. Like, because what suicide does, and Cindy would tell us, is that it leaves the family wondering, where did we go wrong? What did we, what could we have done better? If only, all those questions that the family asks, they're very hurting and they're very, 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 very painful. So for us to be able, and they cannot be avoided anyway, but nobody knows this thing is happening or is going to happen, and you don't go thinking that your child is going to, kill themselves. You don't want to know whether you don't know whether your loved one is going to kill themselves. You can only hope that they are able to come and talk to you and share what they're feeling and what they're thinking. But our part is just to be observant about our loved ones. When things changes, that we can intervene at an earlier age, at an earlier time, rather than when things are just, when they have escalated. I think that's the only preventative measures that we can put, because once they speak, like what we do in mental health is that once somebody has said they have suicidal ideations, that is when we assess risk. What do we need to do here? What are the protective factors? What can we put in place? And that is being proactive and doing that. But all I say is that for those who want to kill themselves, they do end up killing themselves. Sometimes they either kill themselves through misadventure, or because that is what, they were going to kill themselves anyway, no matter what you do. But at least we can save a lot, given that if we give them that space of knowing that they can speak and they can be helped and they can be supported. I think that's the only thing we can do.
And I think that's where listen to understand comes in. not to respond, because when you're quick to respond, and there's a time I was talking to the youths, and we had a youth discussion, and they say that most of the time, especially as parents, we always assume, oh, what's wrong with you? So, and I didn't even think that, because probably I do a lot of that. You just look at it and say, what's wrong with you? Straight away, you've assumed, oh, something is wrong with me. Then they'll tell you nothing. Yeah. So instead, there's some wording, and I'm also coming to that, and I'll start with, I'll ask Esther that. In life, there's wording, there's how we should actually talk to them, and there's wording, rather than just assumption. You're always because they feel like you've accused me already. What's wrong with you? Why are you doing this? Why are you doing this? So there's how we're supposed to word things. And that comes back to tough love, because I know, and I've been there where I'm telling my friend, oh, come on, just snap out of it. Because I feel like, how long are you feeling like this? How long? And what someone said is, because depression or mental issue, mental disorder is not like a wound. You can't see it. It's not something that you can see. It's not cancer. You cannot see it. So because we can't see it, it's easier for us to judge someone and just say, come on, just snap out of it. Enough is enough. And I know we do that a lot. And I've done that to my friend, when I'm like, come on, just snap out of it. And sometimes we think like tough love will work on somebody who's going through mental illness or mental disorder. Would you say that tough love would work, Esther?
So sometimes it would. It depends on the relationship you have with the person. But first of all, let me talk about the young people, for example. Young people, teenagers, or people under 24. That usually they say a young person is anyone from the age of 10 to 24. That time, people's brains are still developing. So it's very hard, unless you're a professional, probably like Veronica, you cannot tell a young person's behavior, if it's a behavior because they're having some mental health problems, or if it's behavior because they are at that stage of developmental, their brains is changing. So the way we talk to them, you cannot tell somebody, snap out of it. If you break your leg, for example, people will give you time to heal, and if it can take up to months. But if you have a mental health issue or problem, sometimes you don't even know exactly what it is you're suffering from. Even professionals cannot. A lot of doctors say, one doctor can say you're suffering from depression. 2 days later, you go to a different doctor, they'll say you have anxiety. Another doctor would say something else. And all those illnesses or disorders can be solved or healed with different medication or different psychological therapies, because everyone is different. So I might come to you because you're having some issues, and I say to you, snap out of it. How long is this going to go? And I might tip you over the edge, because I don't know where you are with whatever you're going through, and my words may be what is going to do the complete damage. So for me, I would rather just let people talk. If you don't have anything to say, don't say anything. And if you don't, because sometimes you'd hear people say, I don't know what to say to them. It's better not to say anything, especially if you are unsure, or if you think your words are going to hurt them more, or if you are not sure what they are going through. Just be a listening somebody. Let them just download on you and pack whatever issues they are going through. You can, and also some of the things we say to people, for example, you might say to somebody, oh, I understand. I can't say I understand unless I've been through it myself. And if I'm going to say I understand, I need to say I understand and offer you solutions that maybe worked for me, or maybe I used when I was going through something similar. So, just offer a cry, just let somebody know, I'm here for you to download. I'm here for you to tell me whatever it is you're going through. We can work things together. If, say, for example, you want to go for a walk, I can accompany you, just listening to you. If you need to cry, I'm here for you to cry. I don't have to say anything. I don't have to do it, especially if you're not a professional, because some of the advice out there is not even validated. People will come to you and say, I'm a coach, I can do this and that for you. And most likely that person has only gone to like a 6-week training. Things like CBT, for example, it takes people years to train and to practice and to be able to apply those tools to help other people. So if you don't know, it's better not to say anything, and making assumptions that, as you said, you know, with our children especially, we use words like, you're giving me attitude. Like, you know, automatically you assume they have a bad attitude. And they're probably just not in the mood to talk. You also go into moods. You don't want to talk to people, and you don't want somebody to just attack you because of the way you are feeling. You probably don't have a mental illness or a disorder. You're just not in a place you don't want to talk to anyone for whatever reason. Maybe you're tired. Maybe you're just feeling in a low mood. And then for someone to come and attack you, saying you are showing them attitude, you are being rude, you are being sassy, all these words we use to describe our teenagers, that is what creates a bigger wedge, because they think, I can't talk to this woman. Every time I come to her, she's already have these ideas about how I'm feeling. She's already got these ideas about how I am supposed to act. So we just create a bigger wedge.
Okay, thank you very much. So
I'm very aware of time. So
it's
go on
fine.
and on.
I understand, especially when you say that somebody cannot tell you they understand, because when they tell you they understand, it's like they're bringing the problem. Okay, now what's the solution? So don't just tell me understand, but also give me a solution to it. And things like snap out of it, those are things that we should actually really avoid. And I know I've used that, and it didn't help. In fact, you made the person worse. They didn't even want to ever see me again because I say snap out of it.
Especially, dear, when you say to people, I understand, somehow you are minimizing their problems. You are making them feel like it's nothing. Like whatever you are telling me, I understand. Like it's nothing. Anybody can go through it, but it's not true. So just telling somebody understand without really thinking about it is just very dismissive. And it shows, it's a clear sign to show you are not even listening to that person. You're not trying to see things from their point of view. You're just saying things from a general point of view, or from your own point of view, or from your own understanding of or other things. You're not giving that person the space and time to just talk about themselves.
Wow, so it's like you have your own perspective about what is happening. Yes, I understand. You know, you've actually really taught me something here, because I like using that. I understand a lot. And from today, to be honest, and that's why, as much as I facilitate these shows, that's why I bring professionals, because I don't know anything. I'm just a facilitator. I'm not a professional, especially when it comes to this. I'm not an expert. So when I bring people who are specializes in different things, that different shows, I learn every day. And today, there's one thing I can take out of here, is the fact that I cannot tell somebody I understand, because the thing is, like you said, sometimes even our youths, and that's where it always starts from, they can't come to us because they say, oh, mommy will already judge me already, or that auntie or that uncle will say already, oh, you're giving me attitude, you know. So I've learned a lot today, and we just started. So I wonder what I'll learn by the time it's 2 hours gone. So thank you so much for that. And just to say thank you to everybody who is watching us today. And I always get angry when people call me, because when they call me, then I just lose everybody who was talking. But I think somebody was asking what's going on, because we just started from the middle. And someone said, I think this is a continuation of the discussion that has been there before. And someone says, Sydney, condolences to your family, Cindy. They just spell it with an S instead of a C. And thank you for raising awareness. Hug Cindy Lawrence. Helen Muhogu, powerful discussion here. This awareness is required. Let's help people. And Lynette, somebody's just calling their friends to come and watch. And we are always quick to say, I know, when you know, when you have no idea at all. Someone say that. And a beautiful input, Esther. Thank you very much. Esther, you're doing well. And thank you very much, everybody. And I'll just say thank you very much, everybody, for watching. Thank you for tuning in. Thank you for taking your sweet time to come to our program today. Like I always say, as Esther and Veronica and Cindy are here to bless us with information and knowledge and to motivate and empower us, you, the viewer on Facebook, you should also bless somebody. And the only way to bless somebody like you've been blessed is to share. So bless somebody by sharing this, this video today. Thank you so much. I have one lady, Caroline Adenya. I like her spirit. You know, I like her positive spirit. They say aura. Or is it aura? She has a good aura. Every day she's here and she's always sharing and supporting, and she's always giving her views and point of views. She's always asking questions, and she's always blessing other people. And she didn't stop there. She also have, I have to mention this because she does a lot. She also have a charity in Kenya, a charity that she does sanitary towels to girls. And we had a show here last time. And then 2 days later, I saw that the government has released 470 million to girls sanitary towels. But I just hope that it's not just in paper, that is going to be in reality as well. And thanks to people like Caroline Adenya, who has actually taken it upon herself with her own money to do something like that. So I'll tell Caroline as well. Caroline, put your details there, put your website. Anybody who wants to support you or see what you're doing will support you as well, because this is part of our work. And like I said again, please share, bless somebody, just as Veronica and Esther and Cindy are blessing you here today. Bless somebody by sharing this video. So share, contribute. We need to hear your views. We need to hear your solutions as well and your ideas. So thank you very much. Cindy, you are brave. Thank you for raising awareness. Veronica and Esther, you are all gems. Thank you. I shared about how you are talking about COVID and forgotten how many people have committed suicide, and my inbox is full. I am glad you're addressing this issue. Okay, so somebody as well is talking about how many people have committed suicide, and because I know she's also a member of a community. She's a community leader, and she's saying a lot of people have committed suicide, and a lot of people actually have inboxed her. So yes, it is true. And we need to create awareness. So I'm so happy with you ladies coming here to talk about this. So now moving on. Veronica, I know that last time, and this is something that's why I want us to talk about it now when we have time. This is something that affects our community as Black people. I'm not saying as Africans, but as Black people, because it extends, you know, I always say that it's in our DNA. It extends to the borders of Caribbean and everywhere. When people are suffering either mental illness or mental issue, because I had somebody who, a daughter was actually cutting herself, and I would like us to talk about that as well. She was actually self-harm. She was cutting herself every time. And she came to my house one day and she forgot and she did this, and I was like, what's that? And she was like, oh, don't tell mom, don't tell mom. But I had to tell the mom, because I was thinking, if she does that and then she dies, and then what will I say? I knew, and I thought, let me don't, because I'm not an expert. I don't know to tell her. So I had to tell the mom so that they can get help. But the mom was so disappointed. She was so angry. You know, she didn't even know what to do. So now she's gone. Oh, it's so sad. I don't even want to talk about it, because I don't know what happened to that child. Because every time you see the child writing really depressing things on their social media, when they write their things, but that's how they express themselves. But if tomorrow anything happens to this child, God forbid, the mom will be the first one to be crying and saying, oh, I knew. But the child came to you, you saw the things. Okay, she didn't come to you, you saw them. And instead of her dealing with it like this, she would think, oh, my daughter's been bewitched. Who has bewitched you? We could have, they'll beat that out of you. If you're in Africa, you think you behave like that. So I just want us to talk about, I want to, Veronica, because you raised this point last time, about us believing this witchcraft and bewitched and this, and associated to mental disorder or mental issues.
Yeah, thank you. Yes, what I have found is that we, and especially within the mental health services is that Black people always come to seek help at point of crisis. So, and when I say a point of crisis, these things have been going and happening at home slowly. And then you find that the family have tried everything. So obviously they started by thinking, let's call home. There could be something going on. Maybe we are cursed, maybe we are bewitched. And also there is also the religious bit about sometimes people think about demons and maybe our child has demons or this kind of thing. But then once they have tried all those things and nothing is working, that is when, and actually they cannot control, the risks are either high and they cannot control, that's when they ending up, maybe the police gets involved, the social workers get involved, because of course in this country, sometimes things are going to, so at that point, that's when we access services, when we are at risk or when the crisis is very high. And what I tell people is that they do not understand mental health issues and what causes mental health issues. Now, I always say that we have, as Black people, we have culture and we have traditions and we have our beliefs. And most of these things, not all our traditions are bad. We have good traditions, we've got good culture, some of it, but some of it has really put us behind because they have made us go on believing some of these things which are not true. And actually the science have come to really kind of put some of these things into light. And I always tell people that our ancestors, they didn't have the answers. And a human being, when they have a problem, they want to find out what is causing this problem. And in the old days, when they didn't have an answer, they obviously believed what they believed for their own, because they couldn't understand. Now, if now we know what is causing this and that, then I don't see the reason then why we should go back to believing those old traditions and beliefs, especially the one that either we have been cursed or we've been bewitched. And also the other one, especially the religious one, don't forget that one, because also that one is another one. That actually people are afraid of going to because they believe it's demons and they have to get a pastor to remove the demons and all that. And some of it sometimes also we extricate, I can't even pronounce the word, from responsibility, because if we understand mental health very properly, very well, you can understand sometimes what causes mental health. And as I said, when we talked in our last meeting, there are different things that can cause mental health. So we're talking about if there has been a traumatic event, childhood experiences, or abuses, like children go through abuse. Even the parent themselves could be abusing the children without knowing, because when you abuse a child emotionally, or you're not emotionally there, present, you're not emotionally present, that can affect a child. So there could be things that have been happening within the family. And you know very well, even back home, we know there are families or people or uncles who abuse young girls, but these things are never spoken about. And then when a child starts behaving in a certain way, we want to blame it to the witchcraft rather than rather than looking what is actually happening, what could have happened. Does that make sense?
Yeah.
So this is what that we want to educate people, that if you see any behavior that is untoward, don't jump into this cultural or the bewitching. Find out what could be happening with your children or with your child or with your family member, because you don't know. And as I said, also, there are so many causes of mental health issues. A physical illness can cause a mental health issue. An abuse, physical, emotional, financial, any kind of abuse, and especially emotional abuse, which is never visible, can cause a lot people to cause mental health, whatever. Now, within our children, because every child is different, as I said, also there could be a biological aspect whereby a child is wired in a different way. We are all wired differently. So one of the children could be very sensitive to things around the house. So they take things more sensitively than the other one. So they are not resilient when something disappointing or negative happens. So they are bound to react in a certain way. So it is really getting to know your children and observing them, and also knowing, am I present for my kids? Am I emotionally present? Am I not only present to all of them, it's also individual because they're all different. So it is really kind of knowing what causes mental health, what could be causing mental health, what are the behaviors that are being exhibited, what can we do, can we get help, rather than, because this idea of being bewitched, it makes things worse than better. So we need to move away from believing about this bewitching and witchcraft and all that stuff, or even about the demons, and really kind of look at the broader everything, you know. So it's good that we, all of us, learn about what causes mental health, what could be causing mental, what are the behaviors, what do people do, how do they start reacting, how do they, you know, what should I look for? So all those things we need to do, because I believe that one of the things that has made us not kind of make any positive movement where mental health is concerned is because of that aspect of religious, traditional, and cultural beliefs that really is hindering us to deal with issues as we need to do. And then it also gets us out of the picture and blame something else, rather than getting in the picture and actually finding out what is happening. It's only recently that within back home, because if you remember very well when we were being brought up, there were things that were being shunned on. There are things you could never speak even to your mom or to someone. And it does not mean that children were not being abused. They get even abused by family members.
Yeah.
Because of the way the people want to keep the secret, they don't want, they value the family, the family coming out than the child.
And the
so
child.
at the expense of the child, then they want to protect the bigger, you know, and then they wonder why their child has ended up doing something extra, you know, whatever, and then they say they are bewitched. So we need to know about mental health. We need to know what causes mental health so that we can be able to deal and find out the cause, rather than coming to that conclusion of assumption, you know, that we have been bewitched. So I think that's my, I don't know whether I've made myself clear.
Yes, you did actually.
Has it made sense? Yeah?
Yes, it makes a lot of sense. And because they've linked it so much with spirituality. It's a spiritual thing, and don't talk about it because people think that we in our house we have demons and and it's too much. And just to talk about, before I tell Esther if she has anything to add on to that, or Cindy, I just wanted to talk about little things that also causes depression or mental disorder or mental illness, because you were talking about some issues, Veronica. And I know last time we spoke about childhood abuse, which was actually touched on. The childhood abuse, the trauma, the neglect, we've also touched on that. And we have social isolation or loneliness, experiencing discrimination or stigma, social disadvantage, poverty or debt, bereavement, losing someone close to the family or close to you, severe or long-term stress, having a long-term physical health condition, unemployment or losing your job, divorce, drug or alcohol abuse, DV, which is domestic violence. All these things can actually hinder, or all these things are causes. So the thing, like you rightfully said, some parents will neglect their children or abuse their children, or separate themselves with their children. There's not that love, and then when this comes, it's spiritual, it's the devil. Now it's the devil, you know. So I think, and somebody rightfully said here, someone said, I don't want to read things yet, but I'll just say what someone said, because it goes with what I spoke about my friend. She said, the lady got angry. She gets angry because she was angry because she has no knowledge of depression, and she lacks knowledge as well. So platforms like this, that we are creating awareness that, guys, please, this is no witchcraft. This is no madness. There's no demon attached to this. Take your child to seek professional help. Even you yourself, learn more about this. If Esther, even me that I do shows, did not tell me last time, let's talk about mental disorder, I wouldn't even know. But because she said it, I went and I started Googling it, and I learned so much about mental illness and mental disorders. I was amazed at what I learned. So I think as parents, or even not parents, I just because you don't have to be a biological parent to someone for you to be a parent. Even if it's teachers or guardians, we need to actually teach ourselves about these things, because like we say that 1 in 4 people in their lifetime, 1 in 4 go through either mental disorder or mental illness. That's a big number. So I think we should actually have knowledge in regards to mental health or mental disorder. So again, before we continue,
what I would say there is ignorance. We need to get out of ignorance. I mean, somebody said that ignorance is our worst enemy.
Yes.
So let us get informed about these matters so that we can come from an informed point where we are well informed, so that we can make informed decisions rather than acting from nowhere and doing things that is going to come and make things worse rather than better.
Even the same Bible that we read, even the same Bible says, my people perish for lack of knowledge.
Exactly.
The Bible rightfully says that. So if the Bible can say that, because God knew that lack of knowledge will make a lot of people die, and that's what's happening, because they don't have knowledge. Everything is go to church and pray, and people are fasting for 20 days and nothing is happening. And the more they're doing that, the more you're getting worse.
Yeah.
And they can't think, let's take this person to the hospital. So lack of knowledge, Veronica, it's lack of knowledge. So that's why I appreciate you guys coming here and creating so much knowledge for us, including myself, that was ignorant before of a lot of issues. So Esther, is there anything you want to add in regards of the so-called witchcraft and spiritual, linking it with spiritual,
Yeah, I agree with everything Veronica has said. There's an ambulance passing by. The biggest issue, I think, in our community is the idea and the belief that we can pray away everything. People believe, even before they go to the witchcraft, they see somebody has a problem, like you say about your friend's daughter cutting herself. That child is probably having some very serious issues. And for her, the only way to release the pressure that she's feeling within her is to cut her skin. Most people do that and they feel some sort of relief that none of us can understand, but it's not healthy. It's not a healthy way of dealing with issues. And at some point, she might stop feeling any relief from that. So she's going to go to the next thing. And God forbid, we don't even want to think what the next thing could be. So, and then most of us in the community, whenever there is a problem, somebody is exhibiting any signs of mental health issues, depression, suicide, anxiety, or whatever, we say, let's pray for her. And it comes out automatically out of our mouths, even before we think clearly what the person is talking about. And then obviously, sometimes the prayer doesn't work, because I personally don't believe prayer works in that way. So obviously the prayers are not going to work and the person is going to get worse. So that's when they say, oh, the prayers are not working because this person has been bewitched. Or there's a generation curse from 100 years ago. We have to go and slaughter some goats or do all these rituals to cleanse ourselves. And it's like digging the grave deeper. The problem is getting larger. Meanwhile, the person you are praying for, or the person you are saying has been bewitched and cursed, is getting worse. Their mental health, their mental turmoil is going on and on and on. So I believe, as Veronica says, people need psychoeducation. And that's what I do. Like in my website, I try to teach people about all these issues we have in our community, about sexism, homophobia, I had a story of a man who went into the A&E in some hospital in this country, and he said he'd been hit by a car. But the injuries he had, it didn't look like he'd been hit by a car. It looks like it was a deliberate thing he did, like he jumped in front of a car. It turned out the person was trying to commit suicide, and he also had other injuries on his body. He'd been beaten so severely for several weeks before he managed to escape, jump in front of the road to be hit by a car, and all because he had said to his family that he's gay. And these are what professionals nowadays are calling honor-based violence, where somebody is being put through a lot of psychological trauma because they are doing something that is not in line with our beliefs, in line with our culture, and is just like a landmine of mental health issues. So that person is now depressed. They're already now in hospital with broken bones on top of their broken mind. Is just like it has to stop at some point. And that's why, like my website, I like to tell these stories because it's an easier way. When you tell people about psychoeducation, it sounds like something so large, so complicated, and so unfathomable, people cannot understand. But little stories like that will make people be aware. It's not a curse sometimes. Well, most of the time, it's not a curse. It's not a generational curse. It's not deviant. It's just the way somebody is. And if we understand, we'll be able to help that person. If we understand, we'll be able to sympathize with somebody, or we'll be able to create and offer some support. You don't have to be a professional to offer anybody support. I keep telling people this. You do not have to have a badge saying you're a mental health professional, or you are, you can offer support to somebody if you understand about these things, not understanding the problem they are going through, but understanding about these things. That's why psychoeducation is important in our community.
Thank you. Thank you so much. I'll go to Cindy. Cindy, do you have anything to add on to that? The fact that when someone has all this mental illness, they straight away is spiritual. You've been bewitched or you're suffering from this, they take you to church. And I also saw a clip last time about a 5-year-old, and her name was actually Rose. And that thing has never left my mind. And this is like 1 year ago, I saw it when they put what is that? A nail here. Yeah. You guys saw that.
I saw it.
And oh God, and they say she's possessed because her mom died having her. She's demon, she has demons. And I'm thinking, seriously, at this day and age, but it's because of awareness. Because in life, you only give what you have. If that's all they know, that if somebody's behaving like that, they've been bewitched, they have demons, that's exactly how they're going also to exercise, things like that. So, but when we create awareness with our platforms, then they'll be like, oh, seriously? So this is not okay. So let me now try a different way. Yeah. So that's why I really appreciate you, my ladies. So Cindy, do you have anything to add on to that?
No.
Okay. Thank you very much. So we'll move on. And you know, like what you are saying, what you ladies are saying about awareness, we did have a neighbor, and probably my sister can see here, she's watching actually. A neighbor of mine in Kenya, though, he had stroke. And you know, with stroke, the way your face just goes like this. And all they could say is, oh my God, he's been bewitched. And me, because I didn't even know what stroke was. So even me, I was believing that. I was like, oh my God, he's been bewitched. Because how can you just all of a sudden you're okay, and then all of a sudden your face is twisting? Unless you've been bewitched, something like that never happens. So me, at my young age, I was also believing the person was bewitched. So if I just stayed in that village for that long, all my mental health will be things like that, you're bewitched. If you have cancer, you've died of, I don't know, you're bewitched. You understand? So creating awareness is very important. And the poor man actually lived for 2 days after that, and he died. So and people are praying, yes, hallelujah. There was so much prayers, but he still died after 2 days. So if they had taken this man into the hospital, and now it's only later I found out Jesus, this man was actually a stroke. So to know, creating awareness or learning these things is very, very important. So I'll go to my next question. So how, and I'll start with Veronica again. As a professional in these areas, this is your area of expertise. What is the most common either health, mental disorder or mental illness that you've come across?
It's depression.
Oh, depression.
Depression is very rampant. It's I think, I don't even know, as you read, you can see that 1 in every 4, has depression. The only thing about depression is that it does go with, there is mild depression, and there is serious and severe depression, which we call clinical depression. So, and I think if you ask me everything, I mean, as we learned from last week, what causes mental health.
Sorry, can you just say those two again? There was clinical depression and what?
There is clinical depression, which is serious or severe depression, or there is the mild depression. Yeah. And as you learn, that depression can be caused by anything. Anything negative in life can cause depression. So that means depression is really is everywhere, or it's the common presentation I've seen within my career. And don't forget that depression also comes within these other mental health issues. So if you've got schizophrenia, depression is in there. If you got bipolar, depression is there. If you got a personality disorder, depression is there. So whether depression is on its own or is accompanied by another disorder, it's still there. So depression is the major or the most common mental illness that you can find. And also remember, we are all prone to it. Anybody, anytime. And it goes with the spectrum as well. I remember when we're talking about mental health, also goes with the spectrum. So today I could be fine. Something happens tomorrow. Although I was 100% today, tomorrow I could be at 80. And then something happens, I could be at 70 or 60. Then if things probably get better, I could go up. So depression is the most common. I would say depression, from my experience, is the most common mental health problem.
Okay, thank you. I'll go to Cindy if she has anything else to add. But before I go to Cindy, just to give her time to think if she wants to add anything, I'll just once again come and say thank you so much to all our viewers on Facebook. And like I said, Veronica, Esther, and Cindy are here to bless us with knowledge and information. And we have to leave here today at least motivated and transformed mentally. So as they bless us, you too, you need to bless somebody. And the only way to bless somebody, guys, is to share the video. So please, once again, I'll say share the video, share it to other groups, share it with one person, share it with your friend, tag your friend to come along, and also listen to this educational talk. Personally, I've been educated so much. So thank you so much. And I'm also just going to read what people have said because I like comments. Guys, bring your comments, bring your ideas, bring solutions, ask questions. Veronica is here. She's a professional. Esther is here. She's also a professional. And Cindy is here as well, who's somebody who's been bereaved. So you guys, if you have any questions, you can ask any questions and we'll be able to answer you. Don't ask me. Me, I'm just a facilitator. I don't know anything. But I have professionals here who will help. Okay, so just read some few things here. So someone said mental health is real. Last year, my friend went through it. She quit her job in Zanzibar, left me with her car and logbook to sell for her. When I called her, she could not even remember who I was. I had to talk to the dad and tell him about the car. We need to invest in mental health centers in Africa. If you say you are suffering from mental health, they tell you it is witchcraft ama ugonjwa wa wazungu. Wow, yeah, that's true. Ugonjwa wa wazungu. So education about it is lacking on this side of the globe. So yes, thank you very much for that. It's true, like we rightfully said, umerogwa, ugonjwa wazungu, you know, so you can't even talk about it because even you yourself, you don't even know what's happening to you. By the way, it's not even your surrounding or your family, yourself, you don't even know what you're going through. So you don't even know how to seek for help. Yeah. So someone say mental health is reality. I have 3 to 4 of my staff nurses off work every month, and it takes a long time for them to return to work because of mental illness. When others get to know you have mental illness, you are being stigmatized, which is true. Society stigmatizes people a lot. Those with mental health are blamed for the illness. That's the same thing, Veronica, you're talking about, and Esther. They blame you sometimes that, oh, what did you do? You're mad. You're this. So you don't want to be mad. You don't want to be stigmatized. So the best thing is keep quiet until you can't keep quiet anymore. And then I have a friend I have a friend who has a child. The child lives in Kenya and she lives here. She knows her child is depressed according to the child's friends. Her child is not talking to anyone and has isolated herself. She has done everything to help her. Her question is, how does she go about this situation? Okay, I'm going to read this again because it's a question and I'm going to send it towards Veronica first. And then if Esther has anything to add on, she can add on, or Cindy. I'll read it again, Veronica, so you can either write it down or understand the question well. I have a friend who has a child. The child lives in Kenya and she lives here in the UK. She knows her child is depressed according to the child's friends. Her child is not talking to anyone and has isolated herself. She has done everything to help her. Her question is, this person's question is, how does she go about this situation as her child is not talking to her family or family members? The only info she gets is through the friend's child. Can you advise how my friend can get about this situation as she is so lost herself on how to deal with the situation? Okay, so I'll give you time to answer that later. And somebody said, okay, they're logged in and they're watching all the way from Germany. Thank you very much, Beverly. And then very educative discussion. Keep it up, ladies. Thank you. The only downfall is, thank you. Somebody responded to the lady, but she said, thank you. The only downfall if she doesn't want to communicate with no one in her mother's family. Okay, that would be difficult one, Esther, but Veronica, but you'll have to help this lady. She's actually so lost herself and she needs help. And then someone said, money will never be enough. I have a cousin who looks confused, who looks confused. The mom has never lived with her. She stays in the UK and thinks sending her gifts is enough. She's now 27 years. He has never spent time with the mom for more than 1 month. So that is a problem as well. When we come here, we say, seeking for greener pastures, and then we don't spend time with our children. And last time, actually, when we had this discussion, somebody actually inboxed me and the same thing. And her words exactly, well, I'm not going to mention names, so maybe she's actually maybe listening, but she said, and she doesn't mind me saying this, she said that if time was to be reversed back, she would not come to the UK. She will stay with her children because she came here looking for greener pastures. She worked so hard and all that money is in vain because her children are now, they've lost it. So she regrets it so much. So money is never enough. Like somebody rightfully said, money is not enough. And then someone said, okay, and then there's a lot of people who are talking among themselves, which is good. I really, really encourage that. And somebody said, yeah, I'm enjoying the talk. Good to see you. And then someone said, Veronica, please, may you summarize? Okay, Veronica, this is yours again. Veronica, please, may you summarize the difference or categories of mental health as it sounds complicated. So write that down as well, Veronica, please. Yeah. And then someone said, yes, amazing conversation. I arrived late, but will rewatch the show. Bless you, ladies, and keep it up. Cindy, you remain in my heart since I watched that first show. Or this person watched last week as well. The two mental health professions here. God give you all you need to continue your work. Yes, Esther and Veronica, somebody just prayed for you. Thank you very much, everybody. And like I said, you've rightfully said Veronica and Esther, and also Cindy being here with their testimony is blessing you. So you too, you need to bless somebody. So share, share, and share. Write your comments, write your questions. They will answer your questions. Right now, we have 2 questions. Veronica is going to answer them. And if there's anything to add on, Esther is also going to follow up. So thank you very much. So Veronica, I'll let you talk there first. Before Veronica, I wanted Cindy to add on if she had anything to say.
Again, maybe this is for you, Veronica. I have been diagnosed with post-traumatic stress disorder. Does that come, is that still part of depression? Or is that something that, you know, you suffer from it for a little bit and then you come out of it? Because I've had with depression, sometimes there's no healing. So if I've got something like, if I've got post-traumatic stress disorder, is that something you can cure, you can recover from it, or is this something that goes on forever, and is it part of depression as well?
Post-traumatic can cause depression. And when they say traumatic, I want you to focus on the word trauma. So trauma is what happens. So for example, if you have an accident, you can have the physical trauma where there is that injury, and you can see later on maybe there is an injury because it left a trauma. Now, when we talk about the trauma in terms of mental health, is because of the effect that that trauma have had on you. So, for example, with you losing your son and through the suicide, it really was a big traumatic thing. So I want you to move away now. If you think about an accident where it causes, depending on the seriousness of the accident, the kind of trauma it does on the physical body. Now you want to start thinking about what that did to you in terms of your emotions and in terms of your inner, the way it affects you emotionally, the way you think and everything and all that. So that's what we call trauma, the effects and the after effects of what has happened. Now, these after effects are the ones that they need to be healed and they take time. And so when you have this trauma, most of the time is when you remember, when your mind goes back to the scene, and when you remember, of course, it creates some emotions. And these emotions are painful. So because they're painful, of course, they'll cause you to have depression, which is sadness. Does that make sense?
Mm.
Yeah. So that is what it's all about. And that's why I say depression is everywhere, because depression is a side effect of so many things that when we feel them, and it creates certain emotion that makes us feel down, that makes us feel lose interest, feel unhappy, painful emotions rather. So the post-traumatic is now what happened after the incident with your son. So what needs now to happen is, just like a wound or an accidental wound takes time to heal, even this one is going to take some time to heal. And it is really kind of knowing what skills and what things do I do or I don't do so that I can start healing slowly. So that is what post-traumatic disorder is all about. It's all encompassing. When they say post-traumatic, it can be caused by anything. So yours is for this incident, which is very traumatic. And all you need to do, it can cause depression. So it's also causing you to have that kind of depressive kind of effect. And I think the idea here is to work on that trauma so that you can heal slowly. I hope I've answered your question.
Mm-hmm. Esther, is there anything you want to add to that, please? Because I'm trying to register all these things. When you hear something like disorder,
Mm-hmm.
kind of do people recover from disorders, or is that a lifetime thing?
I think you can.
Anybody. So,
I personally think you can recover, and recovery is not, it doesn't mean like you completely forget about what has happened. Is finding ways to cope that are going to be beneficial for you while preserving the memory of your son. Because your son was born, he was a human being who occupied space on earth, and unfortunately it happened. So as Veronica has explained, the trauma you went through, every time you think about it, is going to bring, you're going to feel those emotions all over again. And then the emotions is going to elicit those feelings of sadness, of being teary, just feeling low. And that would be like a vicious cycle. So for you to heal, or for you to find ways to cope, is just to try and adapt some strategies that you're going to, to be able to deal with those emotions and the feelings that are coming out of it, while still remembering your son. Try maybe even remembering him in the good times, like, I know it's hard, it's not easy. I wouldn't think it's easy. It's a process, and it's a journey that will take a while. But the fact that you are doing this, for example, it is something to show that you're already on the positive You want to get to the bottom of this. You want to understand. You want somebody else not to go through this for you to raising awareness. That is part of your healing journey. One day you'll probably be able to talk about this, raise the awareness, remember your son without necessarily feeling so sad or without necessarily getting the depressive episodes. So I
I'd like to
really,
add something. Yesterday I joined, I've been on my own, like I said last time, I've been dealing with it all by myself because once everybody leaves after the funeral, you're alone. But I was very lucky yesterday. I managed to find I don't know what you call it. Do you call it club, group, community? And in the Southeast only, this is Bromley and Greenwich and Deptford. I was the 239 member to join this small community of every single parent who was bereaved by suicide, and all our children, they've killed themselves differently. There were a few girls, but I happened to notice there were so many boys, young men between 16 and 24. And it's like you were talking about gender earlier on, Lydia. Does it affect boys more, girls? It's just a sad thing to see how many boys, and it's very difficult to, it's sad, just a tiny community, just Bromley, Greenwich, and Dartford, where 239 parents already in this small group, without including London. North London is, so it's really shocking. The suicide number is really, really high. The mental that's affecting our children and us as well. You know, like myself, I don't even know now. Am I depressed? 1 minute, like you say, you go to different doctors, it's different things. 1 minute is depression, 1 minute is post-traumatic disorder. So the mental issue is just too high at the moment.
yeah,
What I
I
can tell,
completely understand that. You know, how the doctors diagnose different things differently. Because as Veronica said, everything is in there. If, you know, whatever you're going through is going to cause you depression, you're going to feel low, you're going to feel sad. And also, you suffered a very traumatic incident. So the ripple effects of that thing that happened is coming to come and stress you. And that's where the post-traumatic stress disorder comes in, because that's the only way they can diagnose that one. And I'm really sad to hear about the statistics you just mentioned. And maybe I can add, the only reason I can speculate is no research here, it's just a speculation. Why there are more boys probably than girls is because men sometimes they don't come out and talk about their issues like women. Sometimes they also say, like, now this is research. It shows some women who attempt suicide, they don't want to die. They're just looking for, for attention, or they want somebody to know they are suffering, and that's the only way of showing it. But for men, when they try suicide, they don't want to, they're not trying, they're actually intent on succeeding.
Yeah, like Sean, he didn't attempt, because some people you can hear they say, oh, they'd attempted suicide before. Sean, it was just one split decision and that was it. And there was no signs, nothing. So he kept everything to himself. And maybe this is why, like you say, men or young boys or whatever, they don't talk emotionally. They just keep it in within themselves. Yeah.
the other thing I would want to tell you,
Thing, about our community is because we have this patriarchal attitude that men are made of stone, that they cannot talk, they don't have emotions, they are not allowed to talk about their problems. It's been ingrained in their brains. Even when sometimes you see some boys, their fathers, they talk to them and say, be a man. You should be looking after your sister, as if they are not human beings with emotions. So they've been brought up to think they cannot go through problems. And then when it happens, when they realize, actually, I'm feeling like this, they think there's something wrong with them for feeling the way they are feeling. So they don't seek help. They just try at first to deal with it. But when you're trying to deal with things you don't even understand yourself, you're just digging yourself deeper.
one thing I could also add, Cindy, maybe I am allowed to say I understand, although I know what they just said, but I don't understand fully because every pain is personal. We could experience the same thing, but the pain would be personal. And I always tell people we could lose a mother, but even as sisters and brothers, we would experience that pain differently. So I do know that your pain would be very different from my pain that I've gone through. One of the things I'd like to tell you is that you have heard about post-traumatic disorder or the depression. What I want you to do is what you're feeling is real. Yeah, it's do not hit your whatever on the diagnosis. Just focus on what am I feeling. Just know, because the diagnosis and everything is there to make us understand what we are going through. But the issue is to go, what is making me feel like this? How can I deal with this? What kind of strategies, what kind of skills, what kind of coping skills that I can learn to help me feel better? Because remember, at the end of the day, this is about how you feel, and it must be very painful. And I can tell you that because I know I've been there. I know how it feels to feel pain when I can't, even though I'm sitting next to you and I'm feeling it, you can't feel the way I'm feeling. I cannot express even how I'm feeling. And I know you cannot be able to express what I cannot really understand. I can try to imagine, I can try to figure it out. The only thing I can validate that I hear what you're saying. I can, and anybody in your position would feel the same way that you're going through. But try and think in this way that there is a trauma there, which is real, and this is what it is bringing to you. And the idea here is, so how do I deal with this? If medication will help, by all means, but also these are the skills on strategies on how to deal with it and how to cope with it that will help you slowly come out of it. And it's a process. It doesn't happen overnight. It is a process, but you get there. And just be that heart positive that you will get there. And as Lydia said, and I'm not saying this in a lightful way, because remember, I've been there, is that somebody else have had it. I want you to have that attitude that somebody have had it worse, although yours was bad enough as well. So that is what I would be able to advise you. Those coping skills are very important. I tell people from my personal experience that I refused antidepressants because I knew the cause. I knew what was causing me feel that way. And what I had to do was to practice skills to help me manage the emotion. Because if I tell you what I was going through, because sometimes I wanted to fly away and fade off, like disappear because of what I was going through. And nobody could understand. Even my younger son, I'm there with him. They're looking up on me, but I don't know what to give. I don't know what else to give. And I'm feeling like I'm broken glass inside. I'm walking and I've got this broken glass inside. But how did I manage to get over that? Now I can live with it. It brings me some pain, but I have learned skills and I've learned coping strategies that helps me to really kind of get on with life for my other son. So that's what I would advise you from a personal experience view. Does that make sense?
Mm-hmm.
Yeah, that's how I would do. Because sometimes you can be so focused on the diagnosis and we fail to realize that this is about me and how I'm feeling and how can I feel better? How can I get better?
And I think it also helps. I don't know, but I feel it also helps as well. Sometimes, like you said, Veronica, if you know why you're feeling like that.
Exactly.
So if you know why you're feeling like that. So I want you to I just want to ask Esther one question first before I can go back to you, Veronica, to answer those two questions that you were asked. But I want to say, Esther, with depression, sometimes I'm just asking this because I know you're the one who spoke about guilty feelings. Sometimes you feel like some people don't want to come out of it because they will feel guilty that, oh my God, if I come out of it, they will feel guilty that they will forget the reason why they're depressed in the first place. So let's say, example, maybe you've lost a loved one, and you're feeling, oh, if I come out of this depression, it's like I'm forgetting my child, or I'm forgetting what I was going through. Do you think that's also a cause of somebody just staying and suffering depression for like forever?
Yes, is one of those reasons we have, and most of these things actually they're just like cultural beliefs and cultural issues. If I say you know, some people will judge you thinking, oh, she recovered quickly, or is behaving like nothing ever happened. It's like she's forgotten her child. What's wrong with her? So because of all those issues running through your mind, you're also thinking to yourself, oh my God, I better keep this victim thing going on so people can give me more support, or people can sympathize with me. I can take this. Yeah, so and is just making the progress worse, because you're feeling guilty if you get better, and you're also feeling guilty if you don't try. So you are caught in between, not knowing what to do. But as Veronica says, I think it's very important you evaluate your own feeling, what you are thinking and how it makes you feel, and decide for yourself what you want to do to be able to cope, because you can't forget you know your child affected. And then when you remember that the reason he's not here anymore is going to give you pain, is going to make you feel in a certain way, by all means go through that motion, feel what you have to feel, but then you have developed strategies that you are going to say, I'm going to do this for 5 minutes, and then I'm going to get on with life, because your son would probably want you to do that. And you also have other responsibilities. You have a responsibility to yourself and to other children and to everybody who is in your life, and most importantly to yourself. And you owe it to yourself to recover and to help maybe other people. So the guilty thing is a cultural thing we have in our communities, where you know you cannot be happy because people will judge you for recovering too quickly. And then at the same time, if you're taking too long to recover, people are going to say things like, oh,
snap out of it.
and now get us snap out of it, or it's happened now, you know, move on with life. You know.
Yeah, I can understand that, because I'm thinking like every day is different. Like you saw earlier, I was in tears. Last time I was a lot stronger than today. My day is up and down. So if I'm having like a nice day, for example, with my kids and smiling and all this, I'm like, I can't put that on Facebook. People are going to judge me. Look, she's already laughing and dancing, and her child just died recently. She's already forgotten, moved on, because we live in the world. It just makes you, I don't know, but I can understand what you're saying. 100%.
I think it's just the fact that you really need to evaluate yourself for yourself.
Yeah.
Whatever people are going to say, people will always say, and it's actually, it's actually good that you say that, because I also had it down that people put limitations based on their perception of who you are or who you should be. So they they just have these limitations on you based on their own perception. No, she should move on. No, she shouldn't move on. So why are you gonna be? You'll be like this, or should I not? So I think, just like Esther and Veronica have rightfully said, it's always important, and I'm talking to everybody else who's listening on Facebook as well, not just to Cindy. It's important to evaluate your own self and see that, you know what, now I'm well, now I'm still not well. But if we focus in the community and the society, you'll never get better. And coming back to community and society, that is where problem starts. It starts from your mentor, and then it goes to the society. Yes, Cindy.
Can I use somebody famous as an example? I think it was last year, Kobe Bryant died in a helicopter accident with his daughter. Everybody knows that. But the person who gives me a lot of inspiration is the wife, because I kind of follow on Instagram since it happened, and she's always happy. She's always happy. She's always smiling. She's always posing. She's beautiful with her little kids. But it doesn't mean at all she doesn't feel the pain every single day of losing a child. But she's refused to just sit back and cry 24/7. So when I see her, I'm like, if a mother can do that, any mother can do that. I can do that too.
This is where, you know, Cindy, sometimes you hear people talking about self-love. It's not selfish. This is where things like that can be good. sometimes you have to be selfish to help others and to help yourself. You have to block out all the chatter, coming from your friends, from even your own kids. Just shut it all out.
Even
And
some family,
concentrate
don't forget family members do talk as well.
Yeah.
Of course they will. Some of
Those
them
are the number one victim. Number one victim is family members. Those are the number one every time.
Yeah.
Okay, so moving on from that, thank you very much, guys, for that. I just want Veronica to go to the first question, which was, I have a friend who has a child and the child lives in Kenya. If you can answer that, I'm sure you wrote it down. And then after that, you answer the second one as well, please, Veronica.
So first and foremost, I don't know how old this child is. So it's very good to identify the age of the child. Is she an adult? Is she young? How old is she? The other thing is that who is she living with, and what is the nature of her isolation? So has she been able to talk to anyone? Can she be able to talk to someone? If she is isolating and not talking, what I would advise is the people who are near her, all they need, like you had Esther say, is just to be present. If she's not ready to talk, say if she's an adult and she's not ready to talk, she's not ready to welcome any help, she just needs that somebody who is understanding, that they are present, making sure she's eating, she's drinking, they're encouraging her, and they're also encouraging her to eat, not to leave her to be isolative. The other thing is once she starts probably talking, she can be able to say what she's feeling and what she's thinking. So the age is very important because I don't know whether she's a minor, or an adult. I don't know what's her understanding of what she's going through. Does she know what she's going through? Is she aware that she's going through something, or she just, it's something that's like we're saying, sometimes we just feel we want to isolate and we don't have a clue what's happening. So what she needs is somebody who is quite understanding, quite, loving, who is present. And when I mean present is they're not putting any demands on her. Because if you told me to go to hospital and I don't want to go, you can't force me to go. Yeah. But if you feel that my life is at risk, then you can do something. I don't know the system back home, because the system here, if I feel that my loved one's life is at risk because they're not eating, they're not drinking, they're not talking to anyone, we will send the police to do a safety check to see how they are, or just send the social services to either do, kind of section them so that if they're refusing to go to hospital, they can be taken to a place of safety. We don't know. I don't know the system, how it works in Kenya, because also the services or the mental health services are not probably well organized or very well established.
The person have just answered this. They say the child is an adult, and once the family knows where she lives, she moves from the address where she is to another. She's about 29 years old.
Yeah. So I think what they need to do is also to look for somebody who is close to her. Does she have a friend? Because she is making proper decisions to move. So this is a 29-year-old. We don't know why she's making the decisions to move away from where she is when people get closer. We don't know. So I don't know, because when somebody is an adult, there's only so much you can do. They get to a place where you can only let them make the decision that they want to make. But so long as the people who are near her have done their best, then what they don't want to see is, we wish we checked on her. We wished we talked to her. We wished we did something. You know what I mean? So it's really doing the best that they can to support this person, because they recognize that something somewhere is wrong. So that is all I can advise, because then where she is, mental health issues, because what we need to do is doing, we call it risk assessment. Yeah. So when you assess somebody, and what kind of risks are they under? Are they risks to themselves or others, and especially to themselves? If somebody feels that she's not really eating, she's withdrawing, she's not doing anything, or she's not going to work, then she's at risk. And somebody needs to do something urgently, whatever they need to do. Yeah. But if she is in a place where she can make decisions, she is moving from one place to another, kind of running away from other, then maybe they need to give her time to come to terms with what she's going through, and then she can be able. But all they need to tell her is that we are here. We're here for you. we are open, we can be able to help. I don't know whether there is anything else I can add, because when somebody is an adult, there's only so much you can do. But all you can do is do your best to support that, but also give the support that is appropriate as well. Because as you say, if we go with an attitude of forcefulness, the one you were saying about why are you behaving the way you're behaving, they want to go with a compassionate and empathetic approach, that they do understand, they're there, they're present, they want to listen to her, they want to understand her so that they can be able to help. So it's for her now to give her that opportunity to be able to talk and to tell them what it is, so that then they can think about how to get help. I think that's the best way I can advise on what they can do.
Okay. And the second question as well, summarize the difference or categories of mental health, as it sounds complicated.
I think Esther wants to add.
Can I just add to what Veronica was saying?
No, because of time, I think we just move on.
Okay.
Yeah.
All right.
Sorry.
Okay. The categories of mental health.
Yes, please.
Yeah. So we talked about mental illness and what they are. So there are different types of mental health, and there are also major categories as subcategories. So we've got depression, we've got schizophrenia, we've got bipolar, and within schizophrenia, there are so many subtypes of schizophrenia. So you could have a schizophrenia, you could have a schizoaffective schizophrenia. So there are different categories of schizophrenia, but the whole whatever schizophrenia. And if I think you need to put another session where we can talk about this diagnosis separately, because there is too much, so that people can be able to identify what their family or loved ones are going through, because then they can identify the symptoms and signs and symptoms. So for bipolar, as we said last time, it's people get euphoric and also they go down. So they have like 6 months where they are up, very happy, they own the world, their speech is rapid, they want to spend more, they've got all these 101 ideas, but then they all of a sudden they go to depression, and very heavy, serious depression. So that's bipolar. Schizophrenia is when people hear voices. They hear voices. Some people can feel that taste is different. Others can feel that there are things crawling on their skins. Yeah. So there are so many. Others can have paranoia, like paranoid thoughts, whereby they think everybody's suspicious of them, or people are following them, or anything. So they are all come in different categories. So, but the major thing about schizophrenia is hallucinations, seeing things which are not there, testing things which are not there, or feeling things. So we do have different things. So if your person start talking to themselves, or start hearing voices, or doing that, then you know that something, and then it is sometimes accompanied with psychosis. So there is psychosis. Now, the psychosis can be just psychosis caused by drugs, because like we have our young people nowadays, they're taking this cannabis, which is really, really very toxic. And we have been seeing a lot of them in A&E with the crisis, just having a breakdown and having psychotic episodes. So we need to be able to observe our children, what they are. I tell people, search your children, search their beds, search their rooms. Don't just leave them, if they are minor, don't leave them to have all these, because they are going and then started taking these drugs. And then the next thing you know, you have a child who got a psychotic illness. Because the cannabis they're taking nowadays is so toxic. And remember, Esther talked about this is a growing brain. And when somebody has a growing brain, when you want to mess that growing brain with something as dangerous as cannabis or heroin or even things like cocaine, all these drugs, then it messes up with those chemicals in the brain. And usually they end up having this serious mental health, because psychosis is a serious mental illness. So there is personality disorders. There is about 10 personality disorders. We've got borderline personality disorder. We've got dependent personality disorder. We've got narcissism. we got histrionic, so we need to talk about this in another time so that
separate.
we can explain it, and we can explain how they manifest so that you can observe.
Wow.
One of the things with borderline personality disorder I need to mention here, because you mentioned about this girl who was self-harming, comes with self-harming. So they cut themselves, they take overdoses, and it's all to do with their emotions. They cannot manage difficult emotions. Any difficult emotion, they cannot manage it. And what they do, they cut because they want to transfer the emotional emotion to physical emotion. So they are able to transport. Now they stop feeling the emotional pain. They focus on the physical pain. It helps them to feel relieved. So every time something disappointing happens to them or they think bad thoughts, they do self-harming, taking overdoses, trying ligatures. I mean, they do all sorts of things. But then that is cutting themselves or all that does not mean that they have borderline personality disorder. For the young people nowadays, they are also copying each other in school. So they are going to school, they're getting into these groups, and then they are copying each other behavior. So it might not that they have anything, it's just that they are copying a certain behavior. So it's very good to know your child. Because borderline personality disorder is a very serious illness. It's all to do with emotions, but it's all to do with sometimes with childhood traumatic events that happens. So what I meant earlier on was when a parent is not present emotionally, and anything, let me tell you, sexual abuse, especially for girls or even for boys, physical maybe abuse, emotional abuse, bullying sometimes can cause that, although most of the time is the serious stuff. So there are also things that as parents we are supposed to be very much aware and observant. Because also, if you're a parent who is so a perfectionist, sometimes it also affects children, because then they're not allowed to make mistakes. They're not allowed to do anything wrong. They are always chastised. So there are so many things that causes children to really develop a certain kind of a personality disorder. But all in all, what happens is that when they have this emotion, they do two things. They either suppress their emotions or they exaggerate their emotions. So that because they want somebody to hear them and to validate them. And to, as Esther said, they just want to tell someone something is wrong. Does that make sense?
Yeah.
So this is why they do all these behaviors. But I think this needs another session where we can delve into details.
We can going all over the we can dip into it and just be specific of that. So just want to say thank you to everybody watching on Facebook again. And Asanteni, decolonizing mental health when it comes to Western medicine is also an ongoing conversation that we should participate in. So you had that. So next time when we talk about all this, we're also going to talk about that. Somebody said, this is a complex topic. Does depression necessarily lead to insanity? So Esther, I'll give you that, but you answer it later. This is a complex topic. Does depression necessarily lead to insanity? Esther, I think everyone grieves differently, but should people, okay, wait. I think everyone grieves differently, just like Esther said, but still people are always quick to judge. Yeah, people are always quick to judge others. You cannot stop people from talking. You just need to, you cannot stop people from talking. You just need to do your thing and be yourself. Thank you, Esther. Grief is personal. As painful as it is, you give great advice. Feel what you need to feel, then get on with life, because life is indeed for the living. And someone said the child is an adult. Okay, I read that already. And true, grief is very personal. And the mom I think that mom is very emotional. You know, I wish she was here to talk to you guys on a personal level. I think I'll ask this person to give the number, then the person I'll give your number, Veronica and Esther, then the person that can actually call you on a personal level. Yeah, because I think she actually do need help. And somebody, of course, somebody say that a 29-year-old is not a child, but someone say at whatever age a child is a child to their parents. In this case, I would say intervention is key. It is clear this person is seeking attention and they need urgent help, okay? I feel like something crowning in my head. Okay, I feel like something crowning in my head. I don't understand that, but Tina Love, you can elaborate that more and tell us what you feel or what you're saying. So if you want to reach out to Esther or reach out to Veronica, you can. Or even Cindy, who have also started a charity, and I'll let her talk about that in a minute. And then such great information, but for people to accept mental health, never go to them as a savior. It's very patronizing. Go to them as a friend and just listen. And once they trust you, you can suggest further help. Yeah, which we spoke about as well. Great topic, ladies. Interesting, you should talk about cannabis sativa use. There's a lot of information these days advocating the use and legalizing of the drug. Is there something we are not being told? Someone asked her, a speaker is right, get to know your child first, helps talk things through. I was abused with a family member and still fresh in my mind today. Okay, I think I'll give that person, Tina Love, I think you should contact Esther and Veronica and they will help you more into that. They will talk to you more because me, I'm not even an expert in any of these things. I'm just learning as well today. But as Esther and Veronica, they're very, this is their area of expertise. So they will help you, Tina Love. Please reach out to them. And Esther as well, you can actually see the messages on my Facebook, Esther, because I tagged you and they're on your Facebook as well. Please get in touch with Tina Love, please. Yeah, because sometimes it's easier to get in touch with someone than them getting in touch with you. Yeah, so get in touch with her. And so as Veronica as well, please get in touch with her. And then someone say, Veronica, your response is very helpful. True, we need another session to venture further. Yes, we will have another session someday. Yes, internationalization or externalization if behaviors, aggressiveness or depression, anxiety. Okay, Tina said, thanks, Love. I will get in touch, but you guys get in touch with Tina Love. Okay, so again, as I said, Cindy is here, Veronica is here, Esther is here. They're actually really blessing us with information and knowledge that we knew nothing about. So guys, you too bless somebody by sharing this video. I've seen 119 shares, which is very good, but keep sharing, keep sharing, keep sharing. And also ask your questions and your comments as well. We will appreciate them. Thank you very much. So I'll just ask, I'll ask Esther one thing before I'll let Cindy as well come and talk about her charity. And I'll also just tell you why Cindy is here for those people who don't understand. So autism, because I know today we had a discussion with somebody in regards to autism. So would you say, Esther, autism is part of mental disorder or mental illness, or how would you, how would you identify autism? Is it, or is it just?
Autism, I wouldn't say is a mental disorder, it is a learning difficulty. So unfortunately, sometimes when you have a learning difficulty, it's harder for you to relate to other people or to socialize. So your behaviors are not what the society would call as normal behavior. So they would classify that as a disorder, but it is not a mental disorder. It's just a learning difficulty. And a lot of people who go through autism without getting any help at a young age, they grow up to then develop mental health issues associated with their problems they're facing because of being stigmatized and being isolated and being treated differently because of the way they process things, the way they process information, or the way they behave towards other people, which is caused by their learning difficulty. And then from that, they will have mental health issues. But autism is not a mental health disorder. It's a learning difficulty.
Can I say something? I have the experience of living with somebody who was diagnosed with high functioning autism, and that was my son, Sean. And I tried getting him help from NHS from the moment he was diagnosed with it, and we didn't get any help whatsoever because he's high functioning. It's like, can you dress yourself? Yes, you can. Okay. Can you feed yourself? Yes, you can. Can you cross the road by yourself? Yes, you can. Oh, therefore, you're fine. You don't need any help. So he was completely neglected, and he had high functioning autism. And I had to deal with it as well on my own, you know, because they think very differently. And part of the reason why I know 100% there was no way anybody would have helped him. When they're high functioning autism, once they make up a decision, once they make up their mind about something, they never change their mind. And they're quite very, very intelligent people as well, very, very clever. So yeah, in the future, if we ever speak about autism, I have the experience of, but my son was high functioning, which is completely different because in the beginning, he was diagnosed as minor autism, and then they changed it from minor to high functioning. So yeah, it's very tough dealing with the high functioning autism because they don't let you in. They don't let you in whatsoever.
Somebody have even said here that autism is classified in different angles, and we have different kinds of autism. Someone said very informative information. So yeah, so going to
everyone with autism is different.
Yeah.
So, and mostly the problem with the society is we have this idea of what is normal and what is not normal. So if you are low functioning, they will classify that as abnormal. If you're high functioning, they will classify that as abnormal. We are supposed to all be, you know, on one straight line, and that's how they will define what is normal and what is not normal. And unfortunately, when you are classified to be up or down, people are going to treat you differently because you are not going to be able to reason at the same way as, you know, the average person. And I think that's where the major problems will come through, because people are going to feel misunderstood. People are going to feel like they're being treated differently and is unfair.
Is there any difference between high functioning autism and minor autism, or is that the same thing?
I'm not sure, but I think is like high functioning is, you know, being overly intelligent, but at the same time suffering from some minor, I don't know, discomforts, the things you not call as normal, but they are intelligent, they're able to process information very quickly, probably too quickly to take into consideration everything else that may, other factors that might affect a decision making. So for example, if you have to make a decision to go to the shop, say like today, and you want to go and buy milk, and you decide I'm going to the shop, and you just rush out, you're not going to consider it's been snowing, so you probably need a jacket. For them, that is irrelevant information. For somebody who is like really high functioning, they just want to get done. They decide they want to do something and they want to get it done. Whereas somebody else who is like with normal logic thinking and a progression of thinking, they will think it's cold, it's snowy, I probably don't even need that milk, I can get it tomorrow, or I need a jacket, I need to wear a different kind of shoes. Is that kind of different subtle differences, but they make a big difference. For the normal person, for the average person, we are not able to see it. Maybe a professional would, and then we end up treating people differently because they behave differently.
Thank you very much. Thank you very much. Now, Veronica, because of time, I'm not going to take yours because of time. Just to say, yes, very true. I've worked with kids with autism, and they're very brilliant. The assessment from NHS is never accurate. As I've worked, I have a friend who has gone through this. The outcome is never what was diagnosed by the UK government. So it's never correct. So thank you very much once again, everybody who is watching. And like I said, Veronica is here, Esther is here, Cindy is here. They're giving you their blessing and their love. For you also to give somebody blessing and love, please share the video, tag your friends, and comment. Thank you. So I'll go to Cindy now. And people who don't know Cindy, Cindy was here last time. Cindy lost her son through a suicide last year in October 13th, 2020. And she took the negative that happened in her life, and she's trying to turn it into positivity by opening a charity that will help people as well. She says she's not going to just sit back and she doesn't care who says what, but she's going to help people because Sean's death is not going to be in vain. So because of that, Cindy was here last week and she told us everything she's going through. She opened up, which was fantastic because a lot of people cannot open up like Cindy did. And she's also here again today as we continue with what we spoke about last week. And today she's also here to tell us about the charity that she's started in Sean's memory. So Cindy, please, take your time.
Okay, so what I found out is when somebody dies, a loved one, when everybody tries and open up a charity or a foundation. So there's just way too many out there. So what I decided to do in the end is not start one myself, but join in. And like I said, I joined in this bereaved, particularly for bereaved parents. If you visit my website, which is Sean's Tribute, which is www.skd2020.com, you can send me any message if you're a parent or anybody with depression or anybody who's thinking of suicide. Just contact me and I can lead you to where all these people can help, the charity volunteers to help people. Because like I said, I still didn't get any counseling at all whatsoever from NHS. I've had to go private, because I needed to speak to somebody that's, I can't carry on like this. So this club, it's very difficult to know what to call it. Is it a community of bereaved parents or is it a club? What is it? It's very private. It's a closed group, but we do meet up. It's very well organized. We do meet up once a month, one Saturday a month via Zoom, or going out and talking about our beloved ones and all that. So if anybody is bereaved and you contact me, I can hook you up with this bereaved group. And it doesn't matter anywhere in the world where you are. It's a big, 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 big organization that covers everywhere, worldwide, really, which nobody told us. It's not there. If you go on Google and type it, it's not easy to find it because things like cruise, you're in the queue forever. You don't get any help. Samaritans, they will listen to you there on the phone. But this is a group of parents who are healing each other. We've all lost children through suicide differently, and we're counseling each other. We're supporting each other. We're helping each other. And like I said, if anybody has any problems there, anything to do with autism, anything to do with suicide, any negative thinking, or any parents who are bereaved, if they contact me through my website, I will lead you to the right place, the right people. Thank you so much.
Thank you very much, Cindy. And just to repeat, that website is www.skd2020.com. In fact, SKD stands for Suicide Kills Daily, and also it's Sean's initials. That's how the name came about. SKD, Suicide Kills Daily, and it's Sean's initials as well. So if you want to contact Cindy, Cindy lost her son through suicide. If you're going through depression, you're going through what Cindy is going through right now, or even autism, because Sean was diagnosed with autism, you can contact Cindy. Just go and write to her on her website. So thank you very much, Cindy, and thank you very much, my speakers for today. So I'm just going to give you, and this is seconds for just your last remarks. Just for your last remarks, and I'll start with Veronica for your last remarks because we have hit our time.
So all I can say is thank you very much, Lydia, for giving us this opportunity to talk about a very sensitive topic and very important as well. We hope that it's been helpful to those who've been listening. And of course, we hope to have more of this so that we can educate our people, so we can all be able to relieve ourselves of the daily pain. Because some of these things, as we are talking about, they happen to us on a daily basis. We get affected on a daily basis. It is really about how do we cope? What is it? What are these things? How do we go about it? How do we manage it? Because at the end of the day is how do we manage what happens to us? How do we respond to what happens to us? and also having that information about what it's all about. So thank you so much for giving us this opportunity. Thank you.
Thank you very much. Esther, please.
I think Veronica has summed it up well. Yes, just to thank you everybody for contributing and for coming to this show. And also, just as a reminder, mental health issues is not anything to be ashamed about. Is, as we said so many times, it can happen to any one of us. So watch out for each other, look after yourselves, and we are here if you need any help or just even a chat. It doesn't have to be a session or it doesn't have to be advice. It sometimes is just an ear to listen. And I just have to add that on my website, apart from telling the stories, I do add some practical tips that people can read and just arm themselves with knowledge and information. So thank you so much. And also, Lydia, thank you so much for this platform. You really are doing a great service to humanity, and I'm happy to be part of it. Thank you.
Okay, so I'll go to Cindy, please. Cindy, unmute yourself, please. Okay, thank you, Cindy.
Yeah. How did that happen?
Your last remarks, Cindy, please.
I would like to say sometimes a complete stranger can help you more than a relative, more than a doctor, more than anybody. So please, if you have any anxiety and you're having a bad day and you've got negativity, mental negativity thinking, contact me on my website and we can move on from there. And I'm doing my work for charity. It's not something I'm going to sit down and say, oh, I'm going to charge you money for it. Or I'm talking to you for 1 hour, you need to pay me. I'm doing it not as a professional person, but a person who's experienced and lived with this things we're going through. Please contact me. Thank you so much. Lydia, thank you so much for this opportunity today as well. And thank you, Esther and Veronica, for your wonderful advices. Thank you so much.
Okay, thank you very much, everybody. Once again, I would like to say thank you for our viewers. This response is still coming. People are still commenting. So thank you so much, our viewers. But fortunately, we've come to 2 hours. It's gone like that, like that. We only have 2 minutes and it's 2 hours. And we have to keep on time because if we don't, nobody will. But I have to say thank you so much for your love, Esther. Thank you so much for your love, Veronica. Thank you so much for your love, Cindy. And thank you for accepting this invitation once again. And like a lot of people have requested, we're going to come back again, not now, but we'll come back again. We will let you know, guys. Be checking Lydia Tet Olet Facebook. We'll let you know again when we are back because this is a very large subject. We cannot finish it within a day, just like someone said. It's big. But I just want to say thank you. And I always want to read people's opinion or comments so that they don't feel like we're here and they're there. So I just want to say these days they've changed in classifying autism, but with your best with your doctor. Okay, someone say thank you, Lydia, for the show. Very informative, tremendously touching where it has never been touched. Folks has been suffering in silence with these mental issues, but unfortunately they got nowhere to get a remedy. Kudos, good people, and good people for counseling. Okay, yeah. And like Cindy said, you can reach Cindy, you can reach Esther, you can reach Veronica anytime. These guys, I've tagged them up there, so their names are there on Facebook. You can reach them out and talk to them. Please don't reach out to me because I have no clue. I have no idea of this subject, but these are professionals and this is their area of expertise. So somebody said, thanks, Cindy, for sharing your situation, even though it's very recent. Takes courage to talk about your loss as soon as Cindy. Deeply sorry for your loss. It's great that you are trying to help others. God bless. So many kinds dying needlessly. I think it's so many children, she wanted to say, dying needlessly. Nice talk, ladies. As parents and caregivers, we need to do better. Perhaps listen and reach out more. God bless us all. Paula, Cindy, not easy to open yourself up. Pray it reaches those in need. Those Thank you, ladies, for your wisdom, time, and effort. Thank you, ladies, for showing yourselves with us, for sharing yourselves with us. This is love enough. You ladies nailed it. Well done. Thanks so much, panel. And thank you, Lydia. Thank you so much. Without you guys, there is no panel. Without you, there is no Cindy, Esther, Veronica, or myself. But it's because of you guys, you're here. And that's why we've been here for 2 hours without even realizing that it's 2 hours gone. So thank you so much, everybody. Once again, love, love, love. And before we go, I just want to talk about COVID again. Guys, COVID is real. Take care of yourselves. Wash your hands, social distancing, wear your mask, and drink plenty of water, or take your vitamins properly. And what else do they say? And use your sanitizer if you're outside. But if you're in your house, just use water and soap. That's enough. Thank you so much. Until then, we'll see you next week on Saturday and Sunday. We are always here. Love you guys. And follow me on Lydia Tet Olet Facebook so that you can know when we have something up. Thank you. Bye.
At World Remit, we understand what the journey is about, how it can sometimes take a little distance to bring us a little closer together. With ways to save more when you send more, World Remit is here for you, so you can be there for them.